I'm going to shortly turn it over to Dr. Roshon, and then he's going to give us an update, and then we'll open it up to questions. So if you want to put your questions in the chat box that's on the bottom of your screen, if you go to the bottom of your screen, you'll see a chat box. You can click on that, and you can write in questions as we go. And then after Dr. Roshon finishes his update, we will open it up to questions, and I will feed those back to him and repeat the sentence, and then repeat the question, and then he'll be able to answer those to the whole group. So you can either send a question to everyone, or you can select a specific person, which would most likely and hopefully be me, if you want the question to be answered. And I will be able to read that out to him. So that way we can kind of keep the conversation flowing without having a bunch of people trying to jump in. I've got everybody on mute and videos are turned off. As soon as I hand it over to Dr. Roshon, I will also turn off and mute my video. And just in case for any of you guys that might not know, my name is Kelsey Erickson, and I am the Safe Sport Director at USA Cycling. And so we're excited to have you here, and we're grateful for the opportunity to have Dr. Roshon with us here as well. So without further ado, I'm going to go ahead and hand it over to Dr. Roshon, and we will get this going. Dr. Roshon, it's all you.
Excellent. Thanks so much. Thanks, everyone. I hope you're all enjoying your working from home state. I'm definitely still in the hospital, so I'm in my office right now. So if you hear any background noise, it's just the general workings of the hospital. So by way of introduction, I've been a team physician for a number of pro cycling teams over the years. I've worked at all different levels of the sport. In my day job, I'm an emergency physician here in Colorado Springs, and I'm the chief of the medical staff for a large system in Colorado Springs. We have an incident command that's set up to deal with this coronavirus crisis, and I'm the lead physician on that incident command. So I've been involved with this sort of from the beginning. That being said, nobody is an expert in this, and so anytime you try to make predictions, you're probably going to be wrong, at least in some points. So I'm comfortable with that. So we'll see. Before I started as an emergency physician, I actually got a PhD in microbiology and immunology, and I studied retroviruses. So some of that basic science side of the viruses I have a pretty good handle on. So we'll see how many questions you guys have. I wanted to start just with a basic update. I assume many of you have been here for some of the initial ones, so I'll try to make this a little bit quicker and perhaps leave a little bit of extra room at the end for questions, but I wanted to just make sure we're all on the same page. So I'm going to stick with my initial thoughts, which are this crisis is definitely a cause for concern, but it's not a cause for panic. And the difference there is that we know what we need to do about this, and we have proven now that we can alter the course of this pandemic and we can control it. We're making some good headway. So there's definitely cause for concern, but there's no reason for panic. So let's just talk about what we can all do. And I want to end with some very specific athlete stuff that I know you guys will have questions about. So, basic thing about this coronavirus, there are several other coronaviruses that we've dealt with over the years. Before about 2003, they were just typical cold viruses. They didn't cause much in the way of severe disease, and so they were mostly ignored. Then in 2003, we had the SARS outbreak in China that hit Canada pretty hard and a few other countries pretty hard. Luckily, the US was mostly spared by that. And then in 2012, we had the MERS outbreak. Those are two very closely related viruses to this current, what they call the SARS-CoV-2 virus, and that's the virus that causes the disease COVID-19. So there are a couple things about this virus that make it very tricky to control the spread, and that's one of the main things I want to talk about. If you look at the overall case fatality rate or the mortality rate of this virus compared to SARS and MERS back in 2003 and 2012, this virus isn't anywhere near as bad. So MERS, the mortality rate was about 30%, and SARS, it was about 10 to 15%. So those were much more deadly, but they didn't seem to spread as fast. This disease has a couple of features that make it very easy to spread between people. Number one, it's spread about the same way that influenza is spread. So it's mostly droplets that are causing it. So if someone coughs and that droplet lands on a surface, and then you touch it with your hands, and then you touch your face, your eyes, nose, or mouth, then that's how you're mostly going to get the disease. In the case of SARS and MERS, the way it got transmitted, what they call the reproduction number, was lower. It was more on the range of a typical influenza season. So that number means if I get the virus, how many people am I likely to pass it to? For typical influenza, that's about 1.3 patients. And if that and influenza spreads essentially worldwide every single year. If we can get that number to go below 1, then it's unlikely that the virus will spread and it will sort of die out. As long as it's above 1, it will spread. And if it's above 2, it will spread very quickly. The reproduction number for this virus tends to be about 2.2 to 2.5. That's way higher than it was for SARS or MERS. There's a couple things that cause that. Number one, there are some people that are asymptomatic. Those numbers were initially thought to be as high as up to 80%. In reality, it's probably way lower than that. We think now it's maybe down to around 20% of people have no symptoms, but people can have very mild symptoms. What that means is the person will have the virus and will be spreading it around, but won't even know it. So it's hard to quarantine people that don't know they have a problem. The other problem with this virus is that people begin to spread the virus before they get symptoms. So even if you are going to get pretty severe symptoms, fever and cough, you'll sometimes be spreading the virus for up to a day before then. Once again, that makes it hard to control the spread. The biggest problem, though, is that almost nobody in the population has any immunity to this virus. So on a typical influenza year, some people will either have had a vaccine or they will have had influenza recently and they are relatively protected. In this case, nobody has any protection of this virus, so the susceptibility of the population is very high, and that seems to be one of the reasons why it's spreading quickly. So it's spreading about, with what they call an R0, or a reproduction number, of about 2.2 to 2.5. That's higher than we've seen with some other viruses like the flu, but it is by no means the highest virus we've seen. If you look at chickenpox or measles, it spreads much, much faster, much more easily than this virus, and we have managed to control that in the past. The other thing I want to make a point of is that spread, that reproduction number, is not intrinsic to the virus itself. It really is an interaction between the virus and the host, in this case, us. So our best chance to control the spread is to control what we do. And we have started to see how that's actually working. So I'll give you a couple of examples. One is on a cruise ship, like on the Diamond Princess cruise ship, that reproduction number was about 15. So it really spread quickly through that entire ship. There's been a couple of other examples where the reproduction number has been very, very high based on what people were doing, how close quarters they were, et cetera. There are a couple of other examples of how it spread quickly in different cities in China. So in the original outbreak, their healthcare system became quickly overwhelmed. In subsequent outbreaks, even within China, where they had enough warning, they were able to shut down the outbreak very quickly and have very few patients, or definitely less than they had in the original outbreak in Wuhan. And that's just an example to us that the opportunity to control the way the virus spreads really is in our hands, and we can usually, we've proven that we can slow down the spread. So that gets us to the question of how is it spread. There's a lot of controversy, frankly, and fear out there about how it's spread. If you look at a virus like chickenpox or measles, they're spread through the air, and so they can travel up to 100 feet away from an infected person. Those viruses are incredibly difficult to control. If you are in a room with somebody with chickenpox and you've never had chickenpox and never had the vaccine, then you're going to get chickenpox. There's no way around it. Same with measles. You're going to get measles if you're anywhere around somebody that's got it. These viruses are not spread that way, it seems. It's mostly spread by contact and droplet. That's very different than airborne. There have been a couple of studies that showed that they could recover the virus from aerosolized particles, but still those aerosolized particles don't seem to travel very far. They don't seem to last very long. And so that level of panic about how it's going to spread like wildfire and we can't control it is really doesn't seem to be warranted. now that we've been talking about this now for, a couple of weeks, we've seen a couple of, pretty incredible examples from other countries about cases where a lot of people have been exposed in a healthcare setting with very minimal protection, and they have not gotten sick. In the original outbreak in China, there were a lot of healthcare workers that were exposed. Most of that we think was before they even really had much of a sense of what we were dealing with. In other countries like Singapore and Hong Kong, and even our experience so far in California and Seattle, the rate of transmission among healthcare workers is much lower than it was in that original outbreak in Wuhan. So it seems to be standard droplet precautions. Wash your hands. Don't be within 6 feet of somebody who is sick or who is coughing. If you can control those things, you can really not contract the virus. The problem, of course, is you can sometimes be around somebody who doesn't know that they're sick and they're still spreading the virus. If you have to be in close quarters with someone, then that's when you would want to wear a mask. So back when people were still traveling, that was my recommendation, is if you have to be on a plane with people you don't know, that's when you might want to consider wearing a mask. Wearing a mask in everyday life is probably not necessary as long as you're staying more than 6 feet away and doing careful hand washing. The longer we go through this, the hand washing seems to be more and more important. Okay, so that's how we can protect ourselves. It's mostly distance, clean hands, use a mask if you need to, don't touch your face if you are out in public. And that seems to be the best benefit of the mask. The mask reminds people not to touch their face much more than it does stopping any droplets or certainly stopping any airborne spread. Travel is a little bit less of an issue now. It's going to become an issue later when things start to open up again. Again, I think you want to be very careful there, since you are in an enclosed space and you can't control everyone around you. That's when I would have just a standard surgical mask. You don't need a crazy mask, but just a standard surgical mask on hand. And again, try to keep as much distance as you can. So then the question is, do these interventions really work? And I think that we now know that the answer is yes. When we had some predictive modeling of what we expected the spread to look like, you can see in cases that have done a good job of doing this social distancing and decreasing unnecessary travel, the spread has really decreased. The unfortunate part is that that time from when you enact a really hardcore, social distancing policy, it still takes a month or even more, and as you're going to see even more and more cases, and that's just because that were the number of cases that were in the community before you did that. So we expect there to be some spread, but it does still seem to be slowing. We still have a few weeks left, and that's important because initially there was some people thinking that we would only have to be on the social distancing protocol for a couple of weeks. That is probably not really going to be the case. It is definitely going to be at least till the end of April until we start seeing things open up. And it's different in every city. If you are in New York, you can see how rapid the spread happened there. New York is going to be closed for a little bit longer, perhaps, than other places as they deal with cleaning up that huge number of cases that they have. Whereas other places here in Colorado, we have mostly been okay. And we expect to see a peak of cases this week, maybe by the end of this week or early next week. And then we expect to see the cases trailing off as long as people are still strict about this social distancing. So it is working. I know it's a pain, but it does seem to be slowing the spread. And the reason that's so important is because if we can spread out the number of cases, then the healthcare system doesn't get overwhelmed. We know that about 5% of people that get this are going to require ICU care. If all the ICU beds are full across the country, then there's going to be a lot of unnecessary mortality. And we really want to try to prevent that by spreading it out a little bit. Okay. That means it's going to be a long-term approach. That means you have to think about how you're going to get through this, not for 1 week or 2 weeks, but how you're going to get through this for maybe a month and a half, maybe up to 3 months, depending on where you live. And that's just psychologically a very different way to think. So you've got to have a plan that is sustainable. You can't just lock yourself in your basement for 3 months. So I want you to think about that. And honestly, I think that luckily the sport that we like is riding, and I think riding is a completely safe sport. If you're outside, not around sick people, in the UV light and in the fresh air, you are, as far as we can tell, relatively safe. So again, my advice is, if you're going to try to get through this, whole 2 month or so problem, don't stop riding. Don't relegate yourself to the trainer unless you have to. So I would say keep riding. You're very unlikely to get sick from riding. Eventually this will be over. There will be more events. There will be more races, probably as soon as this summer. You want to keep your training good, and you want to be ready when those come back online. So the next question is group rides. How do we handle this? I think the old model of group rides, where you go meet a bunch of people that you don't know and you go out for a couple hours in tight quarters, probably is not going to work during this thing. If you have a group of 3 or 4 people, say 3 or 4 roommates that you are already living with, you're already in very close contact with, if you were going to get it, you're going to get it from home much more than you are on the bike. So I think you're fine to go out and ride with some close friends or somebody that you know really well, who hasn't traveled, who isn't sick, who doesn't have symptoms. But again, the large pack's probably unwise. And right now, many places, I'll tell you the way it is in Colorado, they've said you can go hiking and biking and walk your dog and go for a bike ride, but just not in large groups. I would probably follow those rules. I think that is, in some cases, those might be a little bit an abundance of caution, but there's no reason to get yourself in trouble with this. It makes sense. It's just the wrong optics to be out there in a large group when everybody else is making sacrifices. So riding in a group of 2 or 3 people that you know well is probably totally safe. Riding by yourself, I would say, is completely safe. And then riding in large groups is probably not recommended for right now. But again, in a short time, we'll be back to that. One of the things I want to talk about is, because I've heard a lot of questions about this, and people saying, well, I just want to go out and get this virus and get over it so that then I can go back to being normal. We have actually seen that happen in some healthcare workers in Italy. There are doctors that have gotten the virus, that have gotten better, and they're back at work, and they're actually not using protective equipment because they're essentially immune to reinfection. However, I don't think that's a good strategy, and let me tell you why. Number one, in the early outbreak in China, and even in the early outbreak in Italy, the word we were getting back was that the vast majority of people who got very sick were elderly and with comorbidities. Cardiovascular disease, particularly hypertension, diabetes, obesity, tend to cause very severe disease with this, and those tend to increase with age. So it was a lot of old folks that were getting very, very sick. What we've seen in the U.S., in California, Seattle, and now in New York is, while that may be true that the majority of the mortality is in the elderly population, there are a lot of young people getting sick, age 20 to 40. There's been a number of deaths. There's a lot of people getting very ill. It's difficult to predict exactly who that's going to happen to. I don't think you want to get this disease. Why that's happening, we don't really know. I think one of the reasons is probably because if you're an 80-year-old person with underlying medical problems and you had a month to get ready for this virus to hit the United States, those folks are staying inside. And we've all seen the pictures of spring breakers and Mardi Gras people, young people doing crazy stuff. Those people don't seem to be protecting themselves as much, so they may be getting it at a higher rate. But still, the bottom line is it does affect young people. It can be unpredictable, and there's a lot of bad disease in people that are relatively healthy and in their 20s and 30s. The other thing is the way this virus attacks, it enters through the lungs in the vast majority of cases, and it's causing a lot of lung disease. What that looks like for an athlete, we don't exactly know. We know from the original SARS in 2003, people that got severe disease and got sick, their lungs didn't typically come back to being as good as they were. I don't want that to happen to any of you. And that may be the kind of thing where you don't notice it much if you're not an athlete, but if you're an athlete who loses 5 to 10% of your pulmonary capacity, that may be a big deal. So I would do everything you can to avoid getting it this round. Hope that we get a vaccine soon. Hope that we can get this tamped down so it's not as widespread. I would not go looking for opportunities to contract this disease. So then the next question is, what can you do, to be your best if you are getting likely to get exposed, and what can you do to not get exposed? The way this virus infects and causes disease is by causing direct damage to the cells that it infects, at least in the early course. The better your immune system is at knocking this virus out soon, the less likely you are to get severe disease. That is not typical for a seasonal flu. In seasonal flu, a lot of the problem is because the immune system fighting the virus actually causes more problems than it creates. In this case, you want your immune system to be as strong as you can. So how do you do that? The best one is sleep. So staying up all night, Googling the coronavirus and making face masks to protect yourself is probably not the wisest use of your evening. Get some sleep. That we know that helps keep your immune system at its best. Make sure your diet is good. This is not a time, to go, off the rails on your diet and eat a bunch of junk. It's also not a time to try to starve yourself because you think you're not training as much. We know that prolonged fasting can cause some mild decrease in the immune system. This is not a good time to have that. Exercise, but don't exercise too much. I don't think this is the time you want to be, killing yourself, because again, for many people, maybe even most, that does cause some mild immunosuppression. Let's try to do the best you can to keep your immune system in tip-top shape. And then the most important thing is prevention. Hand washing is probably the best thing I can tell you in distance. So that being said, there still are going to be some of us and some of our loved ones that get this disease. So I wanted to just go just another minute or two and just talk about that, what to expect if you get it, what to look for if you're worried that you might have it. So the symptoms can be very mild initially, and they are typically fatigue, fever, and cough are often the early symptoms. It can cause a sore throat. It doesn't typically cause as much of the runny nose and congestion as some viruses do. Again, it does cause that for some people, but typically fatigue, fever, cough, sore throat are the most common initial complaints. It can occasionally start as GI symptoms like diarrhea or vomiting. That happens in about 10% of people. In those cases, they typically will progress from the GI symptoms to cough and fever over the course of a few days. But sometimes the initial one can just be diarrhea or vomiting. There are some people we're learning that the first symptom they have is a loss of the sense of smell or of taste. This, in my experience, this is happening more with young people who don't have very severe disease. Maybe that just means, because if you're coughing and really short of breath, you don't really notice that. But that can be an early feature. It might be a thing to watch out for. And we think that people who have that symptom are probably spreading the disease already. This is not uncommon in other viral respiratory infections, so it's not specific to the SARS-CoV-2 virus, but it does seem to be happening a little bit more frequently there. In most cases, that sense of smell will come back. Sometimes it can take a little while, but it's not anything to be over concerned about. It just might be the first indication that you have. If you get the symptoms, that typically the symptoms can be mild for 5 to 7 days. And then for most people, they resolve and you can have just a lingering cough for the next, week or so after that. The problem is that for some people, after that first 5 or 7 days of mild symptoms, then things get much worse. And those people start to get symptoms of worsening shortness of breath and worsening cough. And that can be a sign that you're developing a viral pneumonia. If you get that and you're getting severe shortness of breath, that's the time when you want to go to the ER. Severe shortness of breath or severe cough, and typically that's going to come 5 to 7 days after the onset of symptoms. If you're developing that viral pneumonia, it can cause oxygen delivery problems pretty quickly, so you want to get checked out. All right, what happens after that? For the vast majority of people that get this, they get a full recovery and don't seem to have much in the way of symptoms that are prolonged. That mild cough may linger, but then after you've had the virus for 7 to 10 days, you're really not spreading it anymore. So the next question I'm getting a lot is like, when can I go back out after I've had it? When can I be around my family again? And what we're doing in the hospital is, if you've had symptoms for 7 days, but you've been symptom free for 3 days. So 7 days since the onset of symptoms, 3 days since your symptoms haven't been bad. And in that case, their definition of symptoms is fever or a severe cough or shortness of breath. So that, again, that mild cough is going to linger on. That doesn't really count as a symptom. So 7 days since the onset, 3 days symptom free, you're no longer shedding the virus. You can be around people. What we're telling people to do is wear a mask so that the risk really becomes absolute zero if you're wearing a mask and not spreading anything. Do that for a total of 14 days since the onset of your symptoms. So at that point, you don't need a negative test to prove that you're clear. If you get the test might come back positive because it's testing for the viral RNA. It's not really testing for your ability to infect someone. So there's no reason to go get another test to prove that it's negative. The next question is, what happens after that? Are you now immune from any other COVID-19 infection? And I think the answer is yes. There have been some reports, some initial fear that maybe people would be susceptible to a reinfection. That doesn't seem to be the case. We know that from a couple of different sources. Number one, we can test in people that get the virus. We can see when they develop these neutralizing antibodies that stop the viral growth. And then shortly after that, their symptoms go away. So we can tell that they're producing neutralizing antibodies, and that typically in other coronaviruses will cause an immunity to reinfection. Number two, with SARS and MERS, which are very closely related viruses, we did see the survivors develop immunity. We don't know exactly how long that immunity lasted, so it may only last for several years. It may not last forever like it does with some viral infections, but it is at least a prolonged immunity. For the MERS virus, it seems to be lasting longer. For SARS, we don't exactly know. Second, we have a good animal model. We have a rhesus monkey model that shows you can infect the monkey with virus. They get sick, they clear the virus, and then they cannot be infected again. And that's about the closest sort of animal model that we have to this disease, so it works there. And then, like I said, in Italy, there are docs who have had this, who got cured, who went back to work without using personal protective equipment because they're, critically low on their stores of PPE over there, and they have not gotten reinfected. So we don't know exactly how long the immunity lasts, but there does seem to be some prolonged immunity after you get the virus. There may be occasional, 1 in a million chances where somebody gets infected, either because of their own immune system or because of the virus changing a little bit. But in general, I don't think that's a valid fear. I think that if you get it, you're going to be okay. I had one last point, which is there's been a lot of talk about this therapy of hydrochloroquine. People have talked about it a lot. And I'm just going to tell you what I think. Nobody knows for sure, but we've heard of people that are taking this prophylactically, trying to take it every day to prevent the viral infection. That is not wise if you're an athlete. This thing has some nasty side effects. This drug has been around since the 1960s, and it's had known antiviral activity in vitro in a test tube since then, and it's never really been shown to have any activity against a virus taken by a person. So in fact, in some cases, it can decrease the immune response and can make people sicker when they get challenged with the virus. I think it's unwise to take it. It's certainly not a miracle cure. It can cause lung and heart problems. I wouldn't take it if I were you. If you have any other questions about that, give me a call directly and we can talk through your specific situation. So there you go. I talked for way longer than I meant to. I apologize, but I just want to make sure we were talking about some of the updates that have happened then. But all right, Kelsey, what questions do we have?
Awesome. Thank you so much, Dr. Roshon. You definitely did not talk too much. I was taking notes the whole time. So I've got some questions. For those of you that have maybe not put them in yet, feel free to be sending them through. I'm pretty sure I've got all of them written out, so I'll keep checking as you go. But we will just go in the order received. So Dr. Roshon, first question is, when is it safe to send athletes on trips to Europe in your mind? We've got a couple people that have trips planned for like under 23s and juniors in July and August 2020. Any thoughts on whether or not that is a good idea?
Yes, I think mid-June is going to be our key point. And again, it really, really depends on where you are going. And what the community spread is like there. So I think by early June or mid-June, we should have a really good handle on this. My suspicion is that by July, limited, careful, necessary travel with all of the right precautions, making sure you've fully checked out the place that you're going, is probably going to be safe. Travel is always going to be less safe than staying at home. You need to get your head around that. It always is. It is every year with flu season. In this case, this virus is going to be with us. It's going to be with us for the next 18 months. And so you have to have a strategy that gets you through the next, year and a half to 2 years. And I know for people in your line of work, saying I can't travel means that you can't compete. So you got to have a way around that.
Awesome. All right, next one. How long can droplets stay in the air? And with that, any idea how that might affect, like even if we're trying to do social distancing and honoring that outside, any concept of how long these might be lingering?
Yes. So when the virus is aerosolized, it lasts for about 3 hours. That really is pretty weak for a virus. If you look at a virus that has really good aerosolized spread or airborne spread, then it can last for days in the air. And so that leads us to the conclusion that this is mostly droplet and contact spread. There is very limited aerosolizing. I'll tell you what we do in the hospital. Wear a surgical mask if you're around people. If we know that we're going to be doing something with somebody that has the virus and it's going to be producing aerosol, like certain respiratory treatments or putting them on a ventilator where we're going to be really close to their airway, really exposed to the aerosol. At that point, we wear one of those N95 masks that really stops any aerosol transmission. Other than that, we don't really wear that mask. And there are lots and lots of examples that we have now of people that have been in very close contact with people, like I said, where they would have definitely gotten the measles from that person. They would have definitely gotten any airborne spread, and they didn't. And there's hundreds and hundreds of cases of that now. So enough that we think we can say pretty clearly. 6 feet seems to be the number, that's what I'm doing. I'm trying to stand 6 feet away from anybody that I don't know or anybody that's coughing. And honestly, that seems to be working.
Awesome. Next question, and we've kind of touched on this before, but we'll go ahead and touch on it again. Is it true that your immune system is weak after a hard workout and therefore that makes you more susceptible to COVID-19? And then if so, what would you consider a hard workout?
Yeah, so I don't think it's true that one hard workout is enough to do it. It really is when you're getting into the beginnings of overtraining. It's more of a chronic problem. So one hard workout is not going to do it for the vast majority of people. It's when you're in a really, really hard block where you're doing a lot of interval training with inadequate recovery, and you're sort of getting weaker and weaker. And look, that happens to people sometimes. Most athletes that I've worked with, they know when they're doing this, a hard 3-day race or 4-day race, followed by a couple days off, followed by another one, followed by another one. They know that when that happens, they're at much higher risk for getting sick. That tells you that their immune system is not working as well. If you know what that pattern is for you, don't do it. Doing an occasional, 1 or 2 sets of intervals per week for most of you, maybe not for me, but for most of you, you're probably going to be able to recover from that just fine, and it's not going to cause any immune suppression. I think it's the combination of inadequate caloric intake plus inadequate recovery that really leads to that. It's very, very individual.
Awesome. Another one that we've kind of touched on before, but we'll go ahead and raise it again. What are your thoughts on kind of drafting and riding in pace lines?
if you're drafting, riding in a pace line with somebody that you know that doesn't have the virus, then you're not going to catch the virus. So that's the bottom line. So like, again, if it's your roommate or your son or your dad, and you're riding, you're living together all day, and then going for a bike ride, you're safe. You're much more likely to catch it at home than you are on the bike. If somebody says, "Hey, I just got off the plane from northern Italy, and I really want to go for a ride," I would not be drafting that person. So that really is what it comes down to, and that's why my general recommendation is no large groups, just because it becomes harder for you to know all of those people. If you had a situation where you really did know every one of those people and they haven't been traveling and they haven't had any symptoms, then you're safe. You can't catch the virus from somebody that doesn't have it. Could you catch the virus by drafting from somebody that did have it? Absolutely. If you're within 6 feet of them and there's droplets, they're coughing and sneezing and all that kind of stuff, then 100% you could catch it. I would still say you're safer on a bike than you are in a house, but the risk is not zero at that point.
Awesome. I think you've actually already touched on this in this one, but I'll just ask it anyways in case I misunderstood. What is the incubation period again? Or a reminder of what is the incubation period?
Yep. So it's variable. Typically, they say it's 4 to 14 days. So 4 days is about the earliest that you're going to start to have symptoms. And if you don't have symptoms by day 14, then you probably didn't get it. For the vast majority, you're going to have some symptoms by day 5 to 7. So those may be mild, and that's the problem, is that you can have mild symptoms and still be shedding the virus. So any symptom you have to treat yourself as potentially being able to share the virus with someone else. But that's the bottom line. What I found is the vast majority of people have symptoms by day 5. By day 5 is sort of the number. That's when I start to relax.
Awesome. This is one that we kind of touched on before, and actually I think you and I have talked about offline, but somebody mentioned that they were concerned about the potential to crash and end up in the ER. Is that something that we should be thinking about, maybe as a proactive measure?
Yes. So you don't want to be in the ER right now. I promise you. You just don't. Most ERs around have had enough of these cases that your risk of contracting it either in the waiting room or outside the ER or in the ER is not zero. So you don't want to go to the ER unless you need to. What do you do about that? Definitely doing crits where you're, sprinting for every corner and all that kind of stuff is probably not wise. Trying to really up your mountain bike game, probably not wise. I would just use a little bit of caution to make sure. I'll be honest, more than riding, what I've been telling people is if you have a chronic disease, now's the time to really manage it. If you have diabetes, and there are lots of riders that do, now's the time to really be serious about your diet, checking your blood sugars, making sure that you don't end up in the ER because of your diabetes and then get exposed. If you have asthma, now's time to really manage those chronic diseases so that you don't end up in the ER unnecessarily.
Awesome. I think we've already touched on this. Somebody mentioned they were what considerations should be given to training volume during COVID outbreak. I think you've kind of already answered that one.
Yeah, I would just go based on what your past is. Now is probably not the time to kill yourself, but you can train. You can do volume. You can do intervals. Just be reasonable with it.
Awesome. Another person commented that they thought this concept that you've mentioned multiple times now, the abundance of caution, is really helpful. And then asked if you could elaborate on the concept of balancing kind of appropriate versus overcautious for coaches and athletes.
Yeah, well, so it really comes down to, look, if there's a global pandemic and a state of emergency that's going to last for 2 weeks, then the way you handle that is very different than the way you handle one that's going to last for 3 months. Or in this case, this is going to be on your mind for the next 18 months to 2 years, at least, I would say. So you've got to have a strategy that gets you through. So going on full lockdown for 2 weeks and then cracking and going on spring break, that doesn't help. Okay. So get yourself a strategy that is something that you can sustain, because I fear you're going to have to sustain it. And so people who say, I'm just going to not ride during this whole outbreak, I couldn't do that. And I'm not anywhere near as pro as most of you guys. So get yourself a strategy that you can live with, and think about your mental health. You know what it's like when you're locked down, when you've been sick or something like that, and you can't leave your house. It's not exactly non-depressing. So you want to come through this on the other end better prepared than anybody you're competing against. And there's 2 ways to do that. Don't get the virus. That's a really good way. And then come up with a strategy that you can live with, that you can perform through this. Getting that middle path of not doing nothing, but also not freaking out and trying to lock yourself in the basement for 2 months.
Awesome. The next comments kind of go together, but so riding with other cyclists that you don't live with seems risky at this point, given that there seems to be some degree of airborne spread when people are exhaling heavily. Any thoughts on that?
Yeah, that's more on the cautious side. Again, I wouldn't ride with somebody that I didn't know. Certainly somebody from out of town or anything like that. But if it's somebody that you know, and you feel comfortable enough to ask them about their symptoms and you believe they're being honest with you, you're probably pretty safe. If you wanted to be careful, you could just, stay in front, not draft, or if you draft farther behind. Again, I think the safest thing to do is don't ride with somebody that you don't know really well, and certainly don't ride with anybody who has any symptoms.
Cool. And that kind of touches on the next one, which was they just highlighted that just because you know someone doesn't necessarily mean that you know who or what they've been exposed to. So potentially it's best to just ride with household people.
Yep. That's by far the safest.
Cool. And then they also asked, how does traveling at high speeds change, or does it change the 6-foot equation?
It probably does. So the likelihood that a droplet will go more than 6 feet if you're at high speeds is that's probably true. Still, it's not like an airborne virus. It's not like anytime you're anywhere near anyone, you're going to get it. I certainly wouldn't want to be in the draft of anyone who's coughing like crazy or has a fever. That's for sure.
Cool. Final question, unless anybody else wants to throw any out there for me on this chat line. Kind of goes on with what we've just said, but so we've been told that many people are asymptomatic. So how do we know that non-household members are safe when it comes to riding?
Yeah, the period of being truly asymptomatic is probably shorter than we had initially thought. When you look at it, it's probably less than a day. So for instance, if you have a friend who says, yeah, I went to go visit somebody and I got back 4 days ago and I feel great, you might want to hold off. If they say, I got back a week or 10 days ago and I've had no symptoms, you're probably safe. That's what I think.
Okay, thank you so much. Oh, I just got a long one. Okay, I'm just gonna read this one as it is. Where is the evidence for approving riding with people you know as opposed to in the household? Aerosolized, I can't say that word, particles are the biggest spread for healthcare workers. Why do you not take the safest hard line and say practice social isolation? We should not be visiting people or riding with people.
So again, that is, if you think this is going to last for 2 weeks, that's probably a rational approach. We can all put up with that. I don't think it's going to last for 2 weeks. I think this is going to be till June that we're going to be doing a lot of these things. And so again, if you're around somebody with no symptoms who is not at high risk and not at travel, I think it's a reasonable thing. Like I said, there's three classes. That the absolute safest thing is don't go outside, don't be around anybody, stay in your basement. If you can keep that up for 3 months, good on you. The next safest thing is to is to be reasonable about it. Try to make sure you know who you're riding with. And then the unsafe thing, I think, is to just ride with anybody there. It's also not true that the most common way that healthcare workers are getting exposed is aerosol. That's just not true. It's mostly droplet and contact, and that's been pretty well worked out since we've been doing this for a while. So the aerosol it's a possibility. It's just a weak possibility with this virus.
Awesome. Well, I don't see any other questions. What I do see is a number of thank yous. So thank you so much, Dr. Roshon, on behalf of USA Cycling, as well as all of the participants that are here. We're so grateful for the way that we are able to just learn from you and be able to continue to bring questions and concerns to you and walk away feeling a lot more sense of control. At least that's how I feel. And I can tell that some of these are saying that as well. So for those of you that are on the line, we will, again, we recorded this. Hopefully this time we'll be a little more effective at getting it shared out, because last time it recorded 180 times, which was unfortunate. But it should be faster this time. We'll get that out to you. Thank you to everyone who joined us live. And once we get it out, please make sure you share it. If you've got questions, I've just been told that apparently when you confirm to be on this, it tells you to send emails to legal and safe sport at USA Cycling or something like that. That's not really an email. So if you have questions, please send them to me. My email address is kerickson@usacycling.org. You can find it all over. It shouldn't be hard. Please send questions to me. I will liaison those with Dr. Roshon, and we will continue to give you as much up-to-date information as we possibly can. Thank you very much, everyone, and have a great rest of your day and week, and talk to you soon.
Thanks, everyone. Bye-bye.
Bye.